Okay. Welcome, everybody. I see the attendees coming in. Wow. Amazing. Welcome. If you feel like it, please introduce yourself in the chat. Exactly. Tell us where you're coming from. Tell us where you're logging in at. We'd love to see you. All right, LA.
Yay, that's me.
That's Dr. Wiseman. Austin, Texas. Hey. Gosh, it is so exciting to see everybody. We're going to get started here very shortly as more of you funnel on in. We have some people.
Oh, I think everyone's putting it in the Q&A, which is fine. But if you want to be input, you can say hi in the chat as well. Chat is disabled. Oops.
Okay, I'm going to fix that. I'm so sorry. I apologize, y'all. First timer over here. Oh, no.
Hey, everyone. Wisconsin, Canada. Awesome. Philippines.
Oh, wow.
Oklahoma. Tennessee. Welcome, everybody.
Welcome. And it's okay. Put it in the chat. Put it in the Q&A until I get this figured out. Oh, wow. Gonna give it a couple more minutes here, just one more minute, and then we will get started with everything. All right. Well, welcome, everybody. My name is Lelena Rabari, and I am so excited to welcome you to Nursing and Pumping Basics for New Moms. I am the North American Marketing Manager for Mom Cozy. I've been with the company since July, and I'm also the Program Manager for Mom Cozy's new breastfeeding support program, which is a program dedicated to helping all of you get the breastfeeding support that you truly need. And I'm here with Colette Wiseman. Colette is a medical doctor. She's also an international breastfeeding certified lactation consultant. Ooh, that's a mouthful. So if you want to hit next, I would love to tell you guys a little bit more about Mom Cozy. So Mom Cozy, we really, as you see, it's mom and cozy, two parts of our name. But for us, it's really important. I know we put baby first. We're all dedicated, great super moms out there. But we also saw a need that we want to put mothers first as well. So when we talk about being cozy, we want moms to listen to their inner voices. We trust where they're taking us. We believe in finding the strength to achieve what we can. And we say cozy is remaining true to who we are, no matter what life stage we're in. For us, it's about cozy power, and cozy power represents the caring love we extend to all of you, to all of our amazing moms, so all of you can be exactly who you want to be. You are moms, but also your wives, your women, your mothers, your friends. You're so much more than that. And we at Mom Cozy truly embrace who you are and are here to encourage and inspire you and walk alongside you in your journey. So that's a little bit about who we are. Next. And yes, I am going to try to undisable this chat when Dr. Wiseman starts. So for now, you can put your comments in the Q&A, but I'll try to get that remedied soon. So a little bit about our company. We actually got started in 2018. We started with the nursing bra and realized that moms need a lot more. We need the freedom to live our lives. And that's why we have since expanded our product line. Our staple is the wearable breast pump. We have nursing bras, but we have other mom care products that you'll find, pregnancy pillows, and also products to support you with baby safety, baby consumables. The goal for Mom Cozy is to be your companion throughout pregnancy and early motherhood. We're always committed to innovating and creating our cozy designs born from love. And next. And I talked briefly about the breastfeeding support program, but this program has various components, and one of the components right now is the education portion. But we created this to provide our moms with more support. And I'm going to put the link to the breastfeeding support program in the chat. Hopefully you can see it. If not, I will go ahead and do it again, but I encourage you to visit this website. You can go to momcozy.com, and at the top of the banner, it says breastfeeding support, so you can learn more about our program. We have education, we have shopping solutions, we have a newly launched Facebook community, and also a lactation consultant scholarship fund for those of you that are getting your IBCLC certification. Next. And I really want to emphasize, we just launched our Facebook community. Please join this community right now. Reason being, Dr. Wiseman, after our webinar today, is going to answer your questions. There is a post that says breastfeeding questions and curiosities. I want all of you to join the group. And if you have questions that were not answered in today's presentation, drop your questions. Dr. Wiseman is actively going to be in our group participating. So make sure to do that. And next. And finally, you get some gifts just for attending today. We're going to give you 15% off, a discount code that's going to be delivered to your email on a Mom Cozy purchase. And of course, you have the chance to win an S12 Pro. So keep an eye on your email. We're going to deliver those, that great news within the coming day. So with no further ado, if you want to hit next, Dr. Wiseman, I'm going to welcome her. She is a renowned expert in the field of lactation. She is board certified in internal and emergency medicine after completing medical school at the University of Chicago and a 5-year residency at UCLA. Today, she has 3 beautiful children and supports moms through her private lactation business and her role as an ER physician. Additionally, Dr. Wiseman is a moderator for Breastfeeding USA Torrance and area support group. Welcome, Dr. Wiseman.
Elena, and I love that you know that my children are beautiful, even though you haven't seen them, because all children are beautiful.
They're all beautiful.
But I'm biased, of course, I think there are too. So hi, everyone. I'm so happy to see so many people here because I love doing breastfeeding support directly to moms, because that's what it's all about, is teaching you so you can teach other people and we can like expand our mom support in the world. So I'm a doctor, but I'm also a lactation consultant. I do a lot of one-on-one work with moms, usually in the first couple of months or the first year. And I have this slideshow to give you a little bit of information, whether or not you've already had your baby. If you haven't had your baby, this is great because you can learn a lot today. If you have, you may pick up some new tips, and you can ask some questions about your situation as well. I tried to be very evidence-based, so based on research that we have and knowledge that we have. But as you all know, we don't have a lot of research on breastfeeding, so there's a lot of expert opinion from myself and from other experts in the field. But if you have questions about where is that coming from, just shoot me a text on the Facebook group and I'll try and reply. So today we're going to talk about benefits of breastfeeding. Why do we want to do it? The basics, so that we all are on the same page with what we're referring to, anatomy and the accessories, how breastfeeding is going to go for you in the first, before you even have your baby, the first hour, day, week, some details about pumping, like why do you even need to pump? Does everyone need to pump? Some tips about pumping, and then some other tips that I always find useful for moms about bottle feeding, and people always have questions about diet and weight loss too. So benefits of breastfeeding, which I'm sure most of you have heard about, that it's really beneficial for the baby because they get some immune globulins and a lot of good, not just nutrients, but a lot of benefits to their immune system, keeping them healthy early on. It's very soothing for babies to breastfeed. It's actually a form of pain relief. It's as good as Tylenol or better. Like if baby's getting a shot and they breastfeed, they show the same kind of decrease in pain level if they're breastfeeding versus if you give them Tylenol or some other form of pain relief. And it's going to protect them from, it's going to decrease their amount of ear infections, gastroenteritis, which means stomach problems, pneumonia, asthma and eczema in the long term, obesity and diabetes, leukemia. These are all, going forward, even if you breastfeed your baby for a few months, they have a lower risk of these things when they're older. And SIDS, which of course is a scary thing that can happen in the first year with babies. And so we want to protect them from SIDS, and breastfeeding will help protect your baby from SIDS. But you may not have known that there's actually some reasons for mom to breastfeed too. You get some benefits too. So of course you get the bonding, and that feels great. And every time you breastfeed or even pump, you release oxytocin, and that's the same hormone that gets released when you have sex. So that feels great. It's not quite the same as sex, but it does make you feel good. It's a feel-good hormone. And in the long term, even years after you've finished breastfeeding, you have a lower chance of breast cancer, ovarian cancer, diabetes, and depression. So this is something you can do for yourself as well as your baby. Let's just talk about the basics here so we're all on the same page. Here's a side view of mom's breast. And the milk ducts go all the way up to almost to the chest wall, almost up to your ribs, and then go down, and they join together into larger ducts and feed into the nipple, and then come out at the tip. The milk comes out at the tip of the nipple here. And the areola, which I'm going to be referring to later, is this darker colored skin around the nipple, but it's very different tissue from the nipple itself. It's much tougher. So baby can put their gums right on it and not cause any damage. And then inside baby's mouth, this is kind of cool because you're seeing how the nipple actually goes all the way into baby's mouth, along the roof of their mouth, and all the way to the back to the soft palate here. And then it gets kind of compressed between the tongue and the roof of the mouth. And then baby will produce some suction to remove the milk. So now that we talked about the basics of the anatomy, I want to give you some tips on what you need to get for breastfeeding. Obviously, you don't absolutely need anything except your breast and your baby. But I can tell you what a lot of people find beneficial. To have a pump available just in case. You should be, if you're in the US, you should be able to get one through your insurance or get one from a friend. Just have it available in case you need it early on. Have a logbook so that you can keep notes of which side baby breastfed on and how long they breastfed for, because the nurses and the pediatricians are going to be asking you those details, and it can be hard to remember. And in 2 a.m. like, wait, did I breastfeed the baby at 11 or midnight? Just for the first couple of weeks till you get the rhythm of things. It is important to give vitamin D drops from the first few days of life. Vitamin D is one of the few things that breast milk doesn't have enough of. I think because we used to live outside more and babies would get more from the sun naturally. But now with us living inside and babies don't get as much sun exposure, they need a drop a day of vitamin D. And you can just put it on your finger and put it in baby's mouth or put it on your nipple before they nurse. I recommend, if you're going to plan to bottle feed at all, because you're going to need to be away from baby for work, or you want someone else to be able to feed them, make sure you have breastfeeding friendly bottles with a slow flow nipple. You don't want the ones made by the formula companies. You don't want the ones with the level 1, 2, 3, really fast flow, because it will make baby start to prefer the bottle. A lot of people like the suction silicone pump. I won't mention the brand name, but it's this little squeezy pump that you just squeeze and put on your nipple, and it just removes some milk without you pumping it. It's just kind of a passive collection device, and that can be really useful. A lot of people like having a nursing pillow. If you don't have to buy this, you can just use bed pillows or couch cushions, but you'll need lots of pillows to prop up baby and prop up your arms so that you can be relaxed. Optional things, a nipple ointment. A lot of people don't end up using it, so I wouldn't stock up on like tons and tons of nipple ointment, because if everything's going well, you won't even need it. Just stay away from lanolin, which is an older product that some people find irritating to the nipples. A lot of people find a nursing bra or nursing tank really useful, and you can get those in many places, like on Amazon or Target or any major store. Just stay away from nipple shields and formula unless you need them. Now, if in some situations nipple shields and formula are helpful, but most people don't need them, and if you start using them, it can really confuse the baby and not be good for breastfeeding. So how are you going to set yourself up for the most support? I want you to learn about what's normal. So listening to this presentation, reading up online, asking your friends, how did it go for you the first couple of weeks? Because it's kind of a big learning curve. And there'll be a lot of things where you wonder, wait, is baby supposed to be eating, every 2 to 3 hours? Yep, they are. And so it could be reassuring to know what's normal. Make sure you have lots of family support, or at least know where your family stands on breastfeeding and whether they're going to be good support to you. There are lots of books about breastfeeding, so you can go look for those and read about it if you want to find out more technical details or more sort of support details. Lots of online support groups, such as the one that Mom Cozy has just started, which I think is awesome. Lots of in-person groups. There's the Latch League, there's Breastfeeding USA, and lots of hospitals will have mom support groups for breastfeeding. I recommend that you prepare some meals and snacks ahead of time. So things that you can eat with one hand. So soup is not ideal, or at least know where your menu is to order in food so that you don't have to worry about food in those first couple of weeks. A lot of moms will stock up their freezer with pre-made food, like food that they make, or takeout food or anything, just so it's really easy to grab food when you're hungry. Find a great lactation consultant. So find them before you have your baby, because it's really stressful when you've just had a baby and then it's 2 or 3 days in or a week in and you have questions, and then you have to start Googling or having your partner Google and try and figure out what your insurance will cover. So find someone ahead of time. We love being contacted ahead of time. We do prenatal consults. So it really is going to help you get set up ahead. And then talk to your pediatrician to make sure that they support breastfeeding, see how knowledgeable they are, and make sure that they're going to be supportive as well. Let's talk about that first hour of breastfeeding. So you've had your wonderful baby. Hopefully everything went very smoothly with your delivery. What I want you to focus on is doing skin to skin. So as soon as baby comes out, and they can do delayed cord clamping, or they can clamp the cord right away, have them put the baby straight on your body. And the reason for this is it actually improves baby's success with breastfeeding. If they separate you and they do lots of things to baby and give them shots and ointments, it kind of inhibits baby from wanting to breastfeed. If you need something medical, of course, don't protest that. But if there's something like a shot or taking a bath that can be postponed for an hour, just have them put the baby straight on you. And ideally, you want to have the baby try to latch within 30 minutes. Now, that first latch might be a bit awkward. Both of you are still trying to figure it out, but at least give them an opportunity. Get that baby's mouth near your nipple, have a nurse help you within about 30 minutes. And these things really, really promote breastfeeding long term. So it's very important. Everyone always wants to know about breastfeeding positions. You don't have to memorize them. You don't have to practice them. But here they are, since everybody asks. Really, most people end up doing just one position that works for them and their baby. But I want you to know that there are different positions that you can use if it's not feeling right to you. This cradle position up on the upper left is kind of the most natural one, where you have the baby in the crook of your elbow and you're just holding them at your breast. But the problem with this is, see how this mom's arm is stuck under the baby and she can't even use her hand. So that a lot of people will move baby into a cross cradle, where they're supporting baby's head with the opposite hand. And now she has her hand free to move her breast or move baby's head. That's what I usually work on with people initially. Football hold, again, just know that it's there, that it's an option if you have a C-section or if you're really sore in the front. You can have baby along your side and baby's legs will be kind of out under your arm. Laid back is getting more popular, and it's amazing if you can get this to work. This can even be your first latching position. And mom is almost completely flat in bed and baby's on top of mom, and babies actually have the head strength to just be on top of mom and latch right on, and it's an amazing natural position. And as baby gets older, you might be laying in bed with baby and you just kind of roll over and let them take your breast. And usually for slightly older babies, that it's a nice option to have, so you can be lying in bed as well. So when we're positioning baby for breastfeeding, a couple of my tips: think about having your tummy to baby's tummy. So I like the position this mom has their baby in right here. Baby's turned on their side, right? You don't want baby laying on their back and trying to turn their head awkwardly to the side. So all in one line. And you're going to bring baby's nose in line with your nipple, not their mouth. You want their nose in line, so they actually have to tip their head back to latch on. And you're going to support baby's head from underneath. If you push on the back of a baby's head, they can arch backwards and push against you, and then they'll come right off your breast. So support them from like under their ear. They have good back and forth movement strength on their own. And you can help baby to open wide by gently pushing down on their chin, just a little bit as they relax their mouth, and you help them to open. And you never want to force a baby to latch on. It's not going to work. It's going to give them an aversion to breastfeeding. So you just kind of make it available and they will latch on their own. There's a couple of pictures of how it should look. So you'll hear more about this when you have your baby and people say, oh, she has a nice deep latch or she has kind of a shallow latch. All it means is how close they are up to the breast. When it's shallow, baby's a little bit far away. They're really just kind of biting down on the nipple, which hurts. And it doesn't work. It doesn't get milk out. You really want baby to be clamping down on the areola. Remember that part that I told you is kind of tough and can take it and it doesn't hurt and it gets the milk out. It's very effective. Baby's right smushed up against the breast. I get a lot of questions about whether baby's going to suffocate because they're smushed up against the breast. I've never heard of a baby suffocating while breastfeeding. If they're drinking and then they can't breathe, they're going to come off. But actually the sides of their noses are shaped differently to ours and air can go in through the side. So even if they're up against the breast, they're getting airflow down the side. Now, if you fall asleep on top of them, that's not so good. But as long as you're awake and baby's up against your breast, it's safe. And here's a really close up of a real baby latching on. And I love this because baby is just so jammed up against the breast and his mouth is so wide open and those lips are flipped back. This one's almost touching the nose. This one's flipped back and touching the chin. And the baby's chin is up against the breast. And this is a wonderful, wonderful latch here. So if you haven't had your baby yet, don't worry about memorizing all of this. Just know that this is what it should look like and that there'll be people to help you to get a deep latch with your baby. And most babies don't get a deep latch at first. They have to kind of figure it out. So you've gone through the first couple hours, done a couple of latches in the first day, and then you're probably wondering in that first week, when do you actually feed the baby? Do you need to wake them up? How often are they going to feed? Basically, you're looking to on demand. And let me just move my video here. So you want to feed them at least every 3 hours until they're back at their birth weight, because all babies are going to lose a little weight and then gain back up. So do wake them up. If it's been 3.5 hours and you realize, oh, my baby has been sleeping for 3.5 hours, yeah, go ahead and wake them up and they'll probably be willing to breastfeed. But if they want to feed after an hour and a half, 2 hours, go ahead. Basically, everything they do, go ahead and offer them the breast. And that'll keep your supply up, that'll keep them full of milk. Then, which side are you going to start on? I recommend you alternate. So feeding number 1, you start on the right side. Feeding number 2, you start on the left. So say at noon, you offer the baby the right side, then the left. And that was a feeding. And then at 2:30, baby wakes up again and wants to eat. Now you start on the left and then the right, so that you stimulate both sides the same. You should expect feeding early on, and this is again the first week or two. It's going to last 40 to 60 minutes. So that's 20 or 30 minutes per side. I know it sounds like a lot, but baby will get more efficient. They're still figuring it out. They're kind of sleeping a lot of the time that they're nursing. So it just takes a while, but that's normal amount. So you're probably wondering, if baby's nursing for an hour and they want to nurse every couple of hours, when does mom actually sleep? So I want you to just naps whenever you can between feedings. Get help, get support for someone to hold your baby, for someone to take care of baby so that you can go to sleep as soon as baby's done feeding, so you're not trying to do everything and clean the house and prepare your food. Just plan on getting lots and lots of support for everything except breastfeeding. Sorry, this is out of order. Then your milk is going to come in sometime around day 3 to 5. It can be a tad earlier if it's your second or third baby. It can be a little later if you had some complications, but normal is day 3 to 5. And your milk is going to transition from colostrum to a more yellowish or whitish substance. And then the volume is going to increase significantly. So you can look out for that to happen in the first week. I want you to take care of yourself. Baby needs a happy and well cared for mom. So it's not worth running yourself down or, not taking care of yourself. You have to put yourself first as well. As far as taking care of your breasts and your nipples, so you may get some engorgement in that first week, and that is just fluid shifts, it's hormone changes. So cool compresses help a lot. Ibuprofen, as long as your doctor's okay with you taking ibuprofen, it's safe for breastfeeding. And it does go down within a day or two. Taking care of your nipples, so a little bit of sensitivity is fine, but soreness and cracking is not okay. It means something's up with the latch, so please get some help. You can put a little ointment on them, you put a little breast milk on them. I recommend letting your nipples air dry as much as possible. Don't cover them with lots of stuff. They will heal much better if they're open to the air. Make sure mom's getting enough sleep. Okay, you're not going to get 8 hours straight, which those of you who have babies already, you're probably laughing here. Like, no, of course you're not going to get 8 hours in a row, but I'd like you to get a 3 or 4 hour chunk plus a bunch of naps during the day, and that should be doable with some support. Make sure you've got plenty of food and fluids, and really taking care of yourself, because you're healing still from the delivery. So give yourself a little bit of time, and make sure you have emotional support. It's normal to feel kind of emotional during this time. Hormones are fluctuating and kind of going crazy. So get some support from family, from friends, especially people who've recently had babies. They really understand. They've been through it. They're going to be your best support. I'd like to have a little discussion of how dad can help, because dads can sometimes feel left out. And especially these days, dads are so much more involved than they ever have been in the past, and they want to do their share, but they can't breastfeed, right? So tell your partner, and this should be dad and partner, tell your partner they can support you by taking care of you, making sure you're fed, doing all the baby care, taking care of the household. And then remind them that basically milk is liquid gold, and every drop that you get out, if you're pumping or expressing, it should be really well taken care of. Yeah, Elena, did you want to say something?
I tell a quick story, mamas. I think you knew I was breastfeeding Colette, and it was week 8. I worked so hard for 4 ounces, and guess what my husband did? Bam, win the breast milk. And I'm telling you, I cried my eyes out. Moms, it's super normal. I'm sure you've been there too. And I know you and I spoke, Colette, that when you work so hard for that milk, you get sad when it goes away. So I just wanted to insert
totally. Yeah, thank you. It is so emotional. You're so attached to this milk that you produce wherever, even when you see a baby spit up, you're like, hey, I made that milk. How dare you? But yeah, that's normal, but make sure everyone else feels the same way, or at least understands that it's normal for you to feel that way about your milk. And tell dad or partner to trust you, that you're going to have some intuition about your baby, that it's hard for other people to necessarily know in the same way. So I want to talk a little bit about pumping. So if you do have the opportunity to get a pump ahead of time, I really recommend it. There's lots of pump options. It can be overwhelming. So this basic pump here, this is a manual pump, and basically you just squeeze this lever down and it pulls milk. The nipple goes here and it pulls milk into the bottle. And so then you can get a single electric pump. So it's just a pump with a single flange on it that goes on one breast. And then you can get a double electric pump. So it's a single pump and it has 2 flanges, one for each breast at the same time, which is definitely more effective, by the way. If you're pumping, best to pump both breasts at the same time. It gives you a bigger hormone surge. And then there's you can get wearable pumps as well, like these ones. So see how these ones have tubing that goes from the pump to the flange. These ones have the pump and the motor and the collection cup all in one. So that can be really convenient. See how this mom is happily cooking dinner for her family as she pumps. So I definitely recommend you get an electric pump. It's just much more effective and easy to use than a manual pump. Manual pumps can be useful as a backup, or if the electricity goes out or something, but if you're planning on doing any pumping, double electric is the way to go. Here's some options you're going to have. You're going to have a plug-in versus battery powered. If you can get a battery powered, because it's really nice to be mobile if you need to pick up that pump and walk around and grab something. Definitely double versus single. I recommend double. Like I said before, it's better to pump both sides at the same time. It takes less time and it gives you a bigger prolactin surge when you're pumping. You'll have an option for wearable cups. So little cups that go inside your bra, or these big kind of classic ones that stick out a bit. Not a huge deal, but if you can get cups, that's great. They can be a little bit more tricky to use, so you might want to start out initially with these ones because you can see what's going on a little better. And then you can get a wearable pump where, again, the pump isn't next to you on the sofa, it's actually inside your bra, so that's an option. But among all these options, I just recommend you get a double electric pump for your #1 pump, however that is. Just make sure you're pumping both sides and that it's electric, not manual. And then if you're able to get a secondary pump, either buy it or get it from your insurance or get it from a friend. A wearable pump with cups is an awesome thing to have because you can just be walking around, or you can pump in your car. You can pump at work with these. I pumped at work in the emergency room with wearable cups, and it was so, for my third baby, but for my first two, I was kind of tied to the wall, and it was so nice with my third one that I could just put the pump in and then continue seeing patients. And it makes your life a lot easier if you have to pump. How are you going to get fitted? Because your pump will come with different sizes of flange. The flange is a plastic part that goes on the breast. To go back here, it's this, I have a picture here, this plastic part here that goes on the breast. So you can measure yourself, and these are actually from the Mom Cozy website, so you can look more closely there if you want to see how you're supposed to measure your nipple. Just remember, it's a starting point. It's not, oh, your nipple is exactly 15 millimeters and you can only use a 15 millimeter flange. It's a starting point. You want to get something that's a couple millimeters larger than your nipple. And your nipple may change size after you give birth. You may get larger, may get smaller. Usually it'll get a little bit larger. So it's a starting point. And then I just wanted to mention how it should look and feel, which is the nipple should move freely inside the flange, and you'll be able to see it from the side. It shouldn't be getting stuck up against the sides of the flange. When you're actually pumping, just some tips and the basics. There's 2 different modes on the pump, and you can ask your lactation consultant or the nurse in the hospital to show you how to use it. It can be a little confusing at first. But all pumps basically have a slow mode and a fast mode. The fast is what you start with. It's just stimulating your letdown to get the gates open to let milk start flowing. Usually you do that for a couple of minutes. And then the slow one is what actually gets the milk out. And this is really important. Again, you don't have to memorize this, but just know that there's different modes, because I've had patients where they had no idea and they were just pumping on the fast mode the whole time, or they started with slow and went to fast because no one ever told them. So just make sure you check with someone you're using the right modes to pump. And then here, most pumps will have on them, they'll show you what mode you're pumping on and what suction level you're pumping on. So this is just an example of what the display might look like. A couple troubleshooting tips. So what if you're pumping and you know you have milk in there because you feel engorged in your breast and the milk is not coming out? So the most common thing I see for this is stress. So stress actually inhibits your letdown. You're like, oh my God, I really need to pump. I need to get it out. I have to rush. I have 5 minutes to pump. And all that tension and stress ups your adrenaline and your cortisol levels, and your breasts say, don't release the milk. Mom is stressed. So just take a couple breaths, turn off the pump, visualize the milk flowing, hand express a little bit, put the pump back on, and usually the milk will start flowing. If you feel like there's no suction in there, check all the connections. So everything has to be pretty tightly connected. And usually it means that there's a leak somewhere, like you didn't push the tubing all the way into the flange, or that there's like a really common one is there's a piece of your clothing, like your pumping bra is like under the flange and not letting it create suction. So just look at where everything connects. That's the most common reason. If you're in pain, you should not be in pain pumping. Please don't maximize the suction. The goal is not to turn the suction up to the maximum. It should be comfortable. So turn that suction down. Check your flange size, have a lactation consultant make sure that you're fitted correctly, or have a lactation consultant look at your pumping. I do this often with moms where I'll go through a pumping session with them and help them optimize their pumping. And if the pump just does not seem to be working right, it keeps switching off, or it is doing something funny or it has suction on one side, absolutely contact the company. They are so willing to help you. All the pump companies that I know of have been great about getting back to you. So just reach out to them. Why would you even need to pump? There's a couple of reasons. One is for your newborn. So if your baby is not transferring early on and you need to stimulate the supply to come in, you'll need to pump usually about 8 to 10 times a day. If you just need to supplement a little bit, your pediatrician says, oh, just give them like 10 cc's after every feeding. Anytime you do give a supplement, go ahead and pump, because you're telling your body to make more milk. Otherwise, your body doesn't know to make more milk. Your baby is completely not latching at all. This might be a NICU baby. This might be because you've chosen not to directly breastfeed, or baby is just really struggling for some other reason. Your goal early on is to pump 8 to 10 times a day. And that'll decrease after a while, but at first to bring your milk in. That's ideal. And you're only going to have a few milliliters or a few cc's at first, so please don't get discouraged. It'll go up quickly in the first couple of weeks, up to 3 or 4 ounces. That's almost half a cup per pumping session by the time baby's a month old. Try to avoid oversupply. I know it's really exciting for those of you who have babies and you pump and you're like, woohoo, I pumped 8 ounces. And the problem is you're telling your body to do something unnatural, or you're telling it to produce enough milk for twins, and it's going to listen. It's going to say, okay, up. And it can get really uncomfortable for you. Elena, did you have something you want to add on that with oversupply?
I want to add to this because I remember when I was breastfeeding and I would get so discouraged because I would see like moms on TikTok having gallons of milk, and I would get so sad because I would just have 4 ounces. And I really appreciated this because you are not a failure if you are getting 3 ounces of milk. And I just love that you're impressing upon this point, because as moms, we feel very guilty or like we're failures if we're not getting the gallons. But as you're sharing, that's not necessarily the goal.
Absolutely. Yeah, we can, social media is great, but sometimes we can get influenced by it and make us feel bad. And then that's really not the goal. So yeah, just know what, again, goes back to know what's normal. That 3 or 4 ounces a session, that's like 1.5 to 2 per side is normal. So make sure you get lots of help from a lactation consultant if you're needing to pump for your newborn, because I want to make sure that everything goes smoothly for you. It's kind of it's tricky early on to get it all right. Milk storage guidelines. So going with the CDC's recommendation is 4 days in the fridge, 3 to 6 months in the freezer. Honestly, it's safe in the freezer for quite a bit longer. The CDC just hasn't done any research. They're being conservative, but nothing bad happens to it. So please don't throw out that milk. It's still safe to use, especially for your toddler, or to donate it. Other reason you might pump is if you're at work, or if you're just separated. I should have said here that if you're just separated from your baby, like you're going to an appointment or you're going out for an evening, just plan to pump approximately every 3 hours. And you may want to talk to your workplace about this. Make sure they have a way for you to have a break every 3 hours. Prepare for it. So you're going to take a half day in practice or take a full day in practice, so it's not so stressful on the first day that you actually go back to work. Get a small stash of milk. You really only need enough for the first day. So that's like literally, probably 10 or 12 ounces. So you do not need to be going crazy pumping yourself into oversupply and filling up your whole freezer space with thousands of ounces of milk. And yes, people do this. And make sure that the scheduler at your work, or that you schedule time into your work for pumping. Make sure you know your legal rights. So here in the US, you are entitled to a private space that is not a bathroom. You are entitled to adequate time to pump, and the law actually doesn't say what that is. So you discuss that with your employer. And you're entitled to milk storage space in a fridge. And that can be the same fridge that people store their food in. It is not a hazardous substance. Don't let anyone tell you that it is. Couple tips. I recommend you just make it as efficient as possible. Again, I pumped as an emergency room doctor with patients, active patients. I had to figure out how to do this quickly. So wearable pump is awesome. Have lots of sets of parts. Store all your milk in one bottle. So you pump, you just pour it into one bottle, put it in the fridge. And then for the next session, take that bottle out, pour it all in, put it back in the fridge. Don't spend time trying to separate it out while you're working. So I wanted to discuss your diet and exercise and weight loss while you're breastfeeding. You don't need anything. You really can just listen to your body. As far as fluids, you'll need about 3 to 4 liters a day, but most people's bodies will tell them that. You don't need to drink 2 gallons of water. You don't, but if you're only drinking 1 liter of water in a day, it's probably not enough to produce as much breast milk as you need, but 3 or 4. You need a little more protein, a little more calcium, a little more vitamin D. So taking a vitamin and just eating a healthy diet is generally a good approach. You burn about 300 to 500 calories in making and producing the breast milk. It's not a huge amount. It's like a small meal or, a decent sized snack. So if you're having trouble with gaining weight while breastfeeding, just look at your calories. You don't need that much more than usual, just an extra snack daily. And a lot of people are interested in how to lose weight. First of all, give yourself a little bit of time. It took 9 months for your body to grow an amazing baby. It is going to take a little time for it to adjust back to where you were. You may not get back to exactly where you were before. Slow changes, slow increase in exercise. If you're a runner, go on a short jog, see how you feel. Most people do totally fine with exercise and it doesn't affect their breast milk. Now, if you decide to get up off the couch at 4 weeks and run a marathon, yeah, your milk supply may get hurt a little bit and you may get hurt a little bit. So just small, slow increases. I'm going to discuss bottle feeding to help breastfed baby, and then we're almost done and I will get to your questions, I promise. So make sure you're using a slow flow or preemie nipple, and for the whole time that you're breastfeeding, even if baby is 6 months old, slow flow nipple. Use paced feeding, which you can Google, and basically you're just making the baby slowly take the milk in, not trying to pour it down their throat as fast as possible. Baby will need about 1 or 2 ounces up to about 3 weeks. They'll need about 3 or 4 ounces after 2 to 3 weeks. And they're going to go to 24 to 30 ounces per day total at a month, and it doesn't change. It doesn't go up. The formula does go up. Breast milk does not go up. Babies get better at taking the nutrients out of it. So big picture from this presentation is, if you remember a few things, remember to do skin to skin, remember to feed your baby on demand as soon as they want anything, just put them on the breast. You're going to use baby's weights and diapers to tell if baby's getting enough, and get help. There's lots of people around to give you help, and trust yourself. You'll know if things are going well. You'll know if you need help. For my presentation. And yes, please, I'm going to start looking at your questions now, and anything I don't get to, if you post it on our Facebook group, I will try and get to it in the next couple of days.
And I know a lot of you put questions in the chat, but please in the Q&A so we can see your questions. But yeah, I think there are a lot of questions here, so I'll let you take it away. But before you do, Dr. Wiseman, I want to make sure you know, if you liked this webinar, we're going to have another called Breastfeeding During the Holidays. And this is going to address your questions in regarding to getting prepared for the holidays. I don't really feel comfortable breastfeeding in front of my family and friends. How do I get the confidence? How do I store my milk? How do I maintain my pumping schedule when I'm busy, when I'm traveling? I really, really, really want to encourage you guys to register for this now. So I'm going to go ahead and pop this in the link, and feel free to take it away, Dr. Wiseman.
I'm going to stop the screen share just so we can see our faces a little better. Okay, and I'll go to the Q&A. Actually, first I want to answer, if it's okay with you, Lillian, I want to answer the questions from the Facebook page first.
Sure.
Because I know some people put things ahead of time that they were really hoping I would be able to answer. So just quickly, and just in general, I want to let you guys know, obviously you're not my patient. I can't offer you very, very specific advice in your case and your baby. But what I'll do is use your question to give you general, recommendations. Like if you say, I'm suffering with engorgement, what should I do? I can certainly tell you what we usually recommend for engorgement. So the first one is kind of a long question, but this is from Sabrina. And her question number 1 is, how can she increase her supply for her 3-month-old baby who's wanting to eat more per feeding? And yeah, so it's not going to increase significantly. Formula fed babies, their volumes increase, but breast milk is not going to increase. So she should be taking about the same amount. She might be getting overfed by caregivers because sometimes they'll use bottles for soothing. So make sure they're not overfeeding and making you feel like you don't have enough milk. You probably do. Nothing has changed with your supply in the last month or with her needs in the last month. Make sure that you pump every time she does get a bottle and you don't skip too many, you don't go too many hours without emptying. And yeah, those are my main tips for increasing supply. Tips to express more milk with a pump. So yeah, I don't have a specific, I can't give you a specific mode or setting for your situation, Sabrina, but I can tell you what I often have moms do is go back to get a second letdown. So you do the fast mode, then you do the expression or the slow mode. And after like 5 or 6 minutes, you might notice that flow is slowing down. So go back to the fast mode and get another letdown. So do another 2 minutes on fast, then go back to get another letdown to the slow mode. You may find that milk starts flowing really well again. You can do that a couple times. I'll have people do that 3-4 times during a session. So it's like 2 minutes, 5 minutes, 2 minutes, 5 minutes, 2 minutes, 5 minutes. So you could try that. And then she has a question about how to unclog ducts and using sunflower lecithin, which I do recommend if you're having lots of clogs. And you can gently massage if you actually feel a clog in your breast that just appeared in the last couple hours. Do some gentle circular massage of it while you're pumping, and that will help it to come out as well. And then question from Laura. She said, how do I prevent clogged ducts? Really just frequent emptying. Make sure you don't go too long without emptying. Some people are just prone to clogs. And if you find you are, you might need to be on lecithin kind of continuously, or at least during the times that you're getting clogs. But making sure you're emptying every 3 hours is the best way to prevent clogs. And it's a great question. Why is my baby fussy at my breast sometimes? She's hungry, but just kicks and fusses around. I don't know how old this baby is, but I just call this funny baby behavior. It's frustrating. You know baby's hungry. You know you have milk. You know, sometimes they just need a little break. If you're getting frustrated, say, listen, baby, we're going to walk around for 5 minutes, then we'll try again. Because it's just, babies just have weird brains. Should we worry about green poop? Is it normal for a 6-week-old to struggle so much to poop? This is from Wendy. So green poop is totally fine. Often can happen after rotavirus vaccine, which is at 2 and 4 months. So you might get some changes in baby's poop color. I often hear parents telling me about that. And it's fine. Is it normal for a 6-week-old to struggle to poop? Yes. They are figuring out their reflexes, their muscles, their coordination. They will grunt, they will turn red. Now, you and I don't do that when we poop because we know which muscles to squeeze. Babies have no idea. All they know is that they want to poop and they're just trying to figure it out. So yeah, totally normal. Why does my nipple hurt with pumping? I would get a lactation consultant to look at it. See if you're using the right size, see if you're using the right modes. Occasionally I'll have a mom who just with a particular pump finds it really uncomfortable, but that's unusual. It's usually more of a flange fit issue. And then last question on the Facebook group was, let's see, baby rejecting the breast. So in general, you can get a baby back to the breast. You have to make it a really low stress place for them. So lots of skin to skin time. And you can also try offering them a little bit in a bottle first, like give them a ½ ounce, calm them down. I call it hangry. Like babies get hangry just like we do. They're so angry, they forget how to feed. Give them a little bit in the bottle, then put them on the breast, give it 5 minutes. They don't want to, tell them that's fine. It's fine with me. We'll do the bottle feed. So just keep it a really low stress place. Now let me go to these Q&As. We have like 100. So again, if I don't get to your question, please put it on Facebook. I would love to respond to you in person.
A lot of these, Colette, are really about like maintaining the milk supply. Yep. Could you just chat a little bit about that? I think there was a question about if I have low milk supply, will my baby not even feed? What are your thoughts about milk supply and just how to increase that?
It's hard. It's usually very specific to your situation. The bottom line is the best way to increase your supply is to make sure to stimulate the breasts and remove milk 8 times a day with no more than a 3 or 4 hour break. So I tell moms it's fine to take a 3 or 4 hour break at night. but not, you can't like wait 8 hours and then do all your pumping in the daytime. So even pumping about 8 times a day. You know, some people even with that, and I say, sorry, pumping or breastfeeding, of course, you know, just effective milk supply, effective milk removal 8 times a day. Some people, even with that, just won't be able to produce enough milk. You can always see a lactation consultant. There's breastfeeding medicine doctors like me out there who can do more of a medical workup, because it can be very individual for the situation. But removing the milk, the biggest thing. So, all right, let me go through some of these questions. Let's see, when my baby feeds on my right side only, it's painful. Why might this be? Everyone has slightly different shaped breasts and nipples, and on each side, like you're not perfectly symmetric. And so your nipple might be slightly different shaped. Your baby may have a tendency to turn their head to one side. So you can experiment with different positions and have a lactation consultant look at it and see what's going on. There's something about the position of their mouth and your nipple. How long is it best to breastfeed? So the World Health Organization says 2 years if you can. The American Association of Pediatrics says ideally at least 6 months exclusive breastfeeding, and then with complementary foods until a year. And then after a year, there's less benefit just nutritionally, but of course there are many other benefits as well. So yeah, my answer, as long as you can. If it means giving colostrum for 2 days that you've expressed and then you're done, you know, I support you and what works for your family. If you want to go for 5 years, go for it. You know, so yeah, do what works for your family. Oh, I do want to mention one here. Someone said, don't guilt people who can't breastfeed, who preemie in the NICU and exclusively pumping. I just have to say to whoever wrote that, you're amazing. Exclusive pumping is super hard. And I can't imagine what you've been through with your baby in the NICU. And I agree, we have to support moms in whatever way. If you had told me that you pumped for 1 day and you were done, I would support you. So you're amazing, however much breast milk you provide. Are the benefits of breastfeeding still applicable if your baby can't get a good latch and you pump and bottle feed exclusively? Great question. So yes, it's almost as good, almost, you know, all the benefits. You're getting the milk to them. That we do think there's a few benefits of direct breastfeeding. So if you ask me which is better, like, sure, if you can direct breastfeed, great. And if it doesn't work, then it's amazing. It's like 99.9% the same to get them the milk that you've pumped. That's because of a couple things. One is it's easier for you, honestly, and you'll go longer if you're breastfeeding your baby rather than exclusive pumping. Because like I said before, it's really hard to exclusive pump. The other reason, we think there's actually some feedback directly from the baby touching the breast, where their saliva tells you, it goes into your breast and tells your body, hey, baby's dehydrated or sick or this or that, and it actually makes the milk perfectly for them, which is pretty amazing. It's a small benefit. It's not everything. I'd still rather you get them breast milk rather than formula if it's an option for you. Pump flange size to guesstimate. Is there any way to guesstimate before baby is here? Yeah, so you can use those tools on the Mom Cozy website, and you can measure your nipple and give you a rough estimate. It's probably going to get a couple millimeters larger, but it's a good starting point. Baby will be 6 weeks on Wednesday. Does she still need vitamin D drops? Yes, your baby needs vitamin D drops all the way till, I would do it till a year if you can. And, you know, don't worry, I promise, even as a doctor, my babies did not get vitamin D every day of their life in the first year. So like, no, we do what we can, right? But ideally, yes. Sorry, I'm getting some sunlight on my face here. I need to close my shade here.
I love how realistic you are, Colette, because
I'm mom too. I get it. We do our best, right?
that question at the pediatrician, I just said yes.
I heard nipple shields are helpful. So nipple shields are one of the things I don't recommend you get ahead of time. I use them with moms who are really struggling, that the only way they can get the baby to the breast is with a nipple shield. It's a tool, so try without. Most people do fine without. If you're really struggling, if your lactation consultant suggests it, then yes, it's a good tool. But it's a pain. You know, you have this little piece of plastic you have to carry everywhere. Wash it. You forget it, your baby can't breastfeed. So try without. How often should you pump a day and for how long? Well, if you're pumping exclusively, especially early on, 8 times a day is ideal. If you are just pumping to get a stash because you're going back to work, once a day, once every couple of days, just to get a little bit to put in your freezer. If you are separated from your baby for work, for appointments, just pump whenever they get a bottle is a rough estimate. Oh, great question here. Are antidepressants going to stop my milk supply? There are so many antidepressants that are completely safe and do not affect milk supply. Please talk with your doctor about specifics, but pretty much almost all antidepressants and mental health medications are completely safe. And I would tell you as a mom, I want to see you happy and feeling good. And you know, if there even was a medication that for some reason did affect your milk supply, I'd rather you were on it and feeling happy and being a good mom. So, but in answer to your question, no, they won't affect your milk supply. My daughter is 3 months and she started feeding only from one breast per nursing session. She seems full and content, but it leaves my other breast feeling full. I pump the other side, but it's a pain. What should I do? So a lot of babies will, if you have a really great milk supply, they'll be full from one side and it's fine. You can just let your body regulate. You don't need to pump the other side. I know that seems kind of weird, like what am I going to do? Leave it for 6 hours, but yeah, just leave it. If your milk supply is good, just leave it. You'll feel a little lopsided. That's the only downside. Your supply will regulate. If for some reason your supply were to decrease because she's only emptying one side, she'll give you signs that she wants to take the other side. So you put her on the other side. So just listen to your baby. Plus you're going to build up like tons of freezer stash that way, and it's going to take over your freezer. So that's no fun. After 3 months of mostly breastfeeding, my baby has started not wanting to latch. And then I have to change breast sides, and then she's fine. Should I worry about this? She may be protesting the flow. So if you're supplementing and not pumping, I see mostly breastfeeding, very little bottle use with pump milk and some formula. Just keep an eye on the formula. If you're supplementing with formula, try and pump at the same time because it can downregulate your supply. But she may be unhappy with the flow if your milk supply was decreasing because you're supplementing with formula. If she's just being fussy once a day and she's just doing like weird baby behaviors, don't even sweat it. That's just baby behavior. Can you do the golden hour if you're having a C-section? I love it. Yes, absolutely, especially if it's a planned C-section. Now, if you're completely under general anesthesia and you're not awake enough to hold the baby, your partner can hold the baby. And so you can prepare them for that. Hey, if I'm for some reason not able to hold baby, it gives it a lot of the same benefits. It regulates baby's blood sugar, heart rate, body temperature. Dad or partner can just put baby right on them. If you're having a C-section with an epidural, so only your lower half is numb, absolutely be like, give me the baby. I want it right here. I want to do a golden hour. So I had my first baby in Europe. No one told me about vitamin D. They told me breast milk has all the vitamins. And now I had my second baby. It's almost 3 months. Tell me why I need vitamin D. So, you know, this is based on evidence testing babies' vitamin D levels. They tend to be a little bit low. Honestly, most babies will do just fine. You know, most babies won't get rickets, which is the vitamin D deficiency. But it does happen occasionally if babies really are deficient in vitamin D and not getting much sunlight. So in the US, we do recommend vitamin D supplement of babies. Let's see, Allison says, first-time mom, women in my family never breastfed, so this is new. I noticed I started leaking colostrum at 23 weeks. How early can I start extracting that? I heard it can induce labor, but I also don't want to waste it. Most women, and please check with your OB, but if you have a healthy pregnancy, 36 weeks is when we generally encourage you to start collecting colostrum. It can cause, now remember, many women breastfeed through pregnancy. So it's not like any kind of breastfeeding or milk extraction is going to put you into labor. But to be cautious, we say 36 weeks. How long does it take for first-time moms to start producing milk? So you, like this last one said, I love this segue here. You guys are awesome. So you're producing colostrum already when you're pregnant. Colostrum is all your baby needs in those first few days. And then first time moms, you can expect your milk to come in around day 3 to 5. And you will notice your breasts get big and warm, and you're like, whoa, something feels different. It's usually kind of sudden, like you wake up and you're like, ah. So 3 to 5 days. If it's beyond 5 days, usually you'll end up having to supplement because baby does need a little bit more than the colostrum by then. Another one about C-section and golden hour, kind of addressed that before. I hear many moms give babies formula saying their milk is not enough. I am pregnant and I don't want to get formula. What's the reason milk is not enough, and how can I avoid that problem? You know, this goes to mom's confidence. If you feel, or people are telling you their milk is not enough, and then you start giving the baby formula and you don't pump at the same time, your milk supply decreases, and then like it becomes the truth that your milk is not enough. So I encourage you to have confidence in your body and your milk supply. Check your baby's weight. If they're gaining weight and your pediatrician is happy, your milk is enough. So please believe in yourself.
And I do want to note this, pediatricians do like a wellness check. I remember I was very anxious about my baby's weight. You can call and say, hey, I just really want to get my baby's weight. Also, lactation consultants do it as well. So feel free to hop by your lactation consultant. They can put the baby on the scale. So I just wanted to offer that too.
Yeah, and I tell, because often in the US, pediatrician doesn't see the baby for 2 weeks. They'll see them the day after the hospital in 2 weeks. And I often tell parents, like, call your pediatrician for a weight check after week 1 to make sure that baby's gaining weight, because that's the point at which they'll have dipped down and then started gaining weight. Or at least you'll know if there's a problem. I get so many calls at 2 weeks where they're like, my baby's not gaining. Like, oh, why didn't we find out earlier? So make an appointment for week 1 to like 7 days old to check. We should probably wrap it up, Lelena. What do you think? And are you copying the rest of these amazing questions?
All of these questions, and I know we have over 100 questions. I will say, please go to the Facebook group and pop your question there. There's a post. It says breastfeeding curiosities and questions. Dr. Wiseman will answer them. Put them there. I'm also going to connect with Dr. Wiseman. We're going to probably funnel through all of these questions. And if there's some that are related, we'll make sure to put them in the group. But we want to make sure everyone gets their questions answered. If you had a good time today, can you say yes? Give us a thumbs up. We are definitely going to send us all this information to you. So we're very, very thankful, and we'll get your questions answered. Let's give Dr. Wiseman a round of a virtual applause. I'm seeing lots of love in the chat. And please just give us a little while to answer your questions, but join us on Facebook and make sure to register for breastfeeding during the holidays and invite a mom who needs this encouragement and needs this education. Thank you, everybody.
Thanks, everyone. It was so nice talking with you all.
Thank you.